Everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and today it's a third edition of Do I Need Medication? So this is a question that came in, and I initially did a little blip on it, little video on it, but I thought I'd turn it into a Thyroid Thursday, maybe a little bit more of an educational tool. Keep in mind, I'm a functional practitioner, not a prescribing physician, so these are just my opinions. This does not mean that this is treatment. Everybody should determine what they need to do as far as prescriptions based on whoever's prescribing them. But this is educational, this is my opinion, so take it for what it's worth. But this is a person who has, their patient has hypothyroid symptoms. And this is after kind of getting a little bit more information as to the background of this question. This is a practitioner who is saying, hey, this was a patient, but I get a lot of patients who have a slightly higher TSH, and this is a person who's been taught that the optimal range for TSH is 1.0 to 2.0. This person's free T4 was 1.3. That's within what's called the optimal or functional range. Free T3 is 2.8, and this is within the lab reference range, but it's outside many people's determined optimal range, which is somewhere in the threes. Some people, I typically look around 3 to 4 as an optimal range. Some people, especially those who prescribe T3 medication, think T3 should be significantly higher. And reverse T3 is 19.1. It's a little bit above the optimal range, but within the lab reference range. So the question here is, from the clinician, is should T4 be prescribed in this situation? What's the harm, right? Shouldn't we just prescribe T4 medication? Could we to lower TSH? The answer is no, we probably shouldn't be prescribing T4 medication. This is a person, and unfortunately we don't have totals, which would be really important to see, but it does look like there's enough T4 available that prescribing me more T4 medication might lower TSH, but if it lowers TSH, it may initially create some benefit, but probably not gonna be helpful. Why? Well, if there's enough free T4 in the system already, the issue isn't there isn't enough T4 to convert to T3. When we take a look at the reverse T3, the free T4 and the free T3, what's probably going on here is there's some type of cell stress response. So the cells are favoring the reduced conversion of T4 to T3. That's an adaptive response to some type of cell stress. And this is what the body's trying to do to protect itself or support itself. So many people look at this as broken physiology. The body is forgetting how to convert T4 to T3, and they want to help out. They want to give medication. Well, maybe that's not the appropriate response. That would be, kind of like saying that, every time somebody has a fever, we need to suppress it because fevers are bad. No, fevers are good because they help with part of the immune response. When there's a threat response going on, reducing the conversion of T4 to T3, increasing the conversion of T4 to reverse T3 can be an adaptive response. When peripheral tissues aren't doing a great job of converting T4 to T3, TSH can stay a little bit higher because there's less circulating T3 in the system to try and drive the thyroid gland to compensate, to make more T3 versus T4. The other thing that may be problematic, if you gave T4 in this situation, there'd be more T4 in circulation, and that could reduce the deactivated 2 enzyme that converts T4 to T3. It can actually ubiquinate or turn it off. And so giving T4 medication too early could lower TSH. It's likely going to raise free T4. It's likely going to lower free T3, and it's probably going to increase reverse T3. The thing that may happen in the long run is that taking that T4 medication, it's going to suppress TSH. It's also going to shut down gland function. So the second question is, should T3 be prescribed, right? So this is a person who believes that they need to manipulate the T3 value. So should we give T3 in this situation because free T3 is a bit functionally low? If the assumption is that the person's body forgot how to do it, then maybe you would say, yeah, I'll give them some T3 and I'll raise T3 in the bloodstream. But is that beneficial? Well, If this is an adaptive response and the cells and tissues are favoring the deactivation of T4 to T3, does you giving T3 provide benefit or potentially create some problems? Giving T3 in that situation could raise free T3. It might temporarily change symptoms, but what it's going to do is suppress TSH. That suppressed TSH may then result in reduced T4 and T3 production at the gland, and that may result in a drop in T4, and that could be problematic for the patient, actually induce a more hypothyroid state. So I would say no. The third question that was really that in a little bit longer discussion with this person is, shouldn't we give some treatment to provide symptoms? The physician is saying, or the practitioner is saying, hey, this is a person who has hypothyroid symptoms. Why not just give them some thyroid hormone to optimize their symptoms or to optimize their thyroid physiology? And I said to them, you're assuming that the physiology is broken. And I'm not. I'm assuming that this decreased T4 to T3 conversion is an adaptive response. So because I think it's an adaptive response, why would I want to force more thyroid hormone into a system that doesn't want it for a temporary benefit? Why not just do what we do in functional medicine and start to ask the question, why is this person reducing the conversion of T4 to T3? Why are they increasing the deactivated form? So I would get busy addressing diet, lifestyle, organisms, toxins, sleep, breath work, all the things that may be creating the reduced conversion and creating that threat response, okay? The fourth question they asked was, won't T3 medications decrease reverse T3 and improve thyroid signaling? No, not necessarily. So if you provide T3 in this situation, will reverse T3 go down? Yeah, it probably will. Why? Because if I give somebody T3 in this situation, what's going to happen? It's going to suppress TSH. TSH is going to go down, and that's going to result in decreased T4 production at the thyroid gland. And if I have decreased T4 production at the thyroid gland, then I have less T4 to convert to reverse T3. And so somebody might think that's good. But the problem is you also have less T4 to be converted to T3. So you're actually creating a problem. The other part of that is that a lot of people believe that reverse T3 blocks T3 from binding to receptors, and it really does not. When we see an elevated reverse T3, it's usually because the cells are favoring the deactivation. They're trying to slow metabolism down, or there's compromised liver function and the person's having a harder time metabolizing that reverse T3 out of the system, okay? So the answer is no. Number 5, what is the harm of just providing the medication? The harm is, A, we're going to potentially create more thyroid signaling problems, and we're not actually fixing the problem. We're actually just managing labs and manipulating labs and symptoms, and that doesn't necessarily help the patient get healthy and get well, and it may lead to an accelerated atrophy of the thyroid gland, in my opinion. Plus, it could also add to side effects. If the person's already in excessive cell stress response, the brain, the pituitary, the hypothalamus is already upregulated. The sympathetic nervous system is already upregulated. So giving them more thyroid medication that's going to saturate the brain, saturate the hypothalamus, the pituitary, and potentially further upregulate the sympathetic nervous system in the short run may make them feel better, but in the long run, there's probably going to create more anxiety, more sleep disruption, more brain fog, and more peripheral symptoms. So no. And then number 6, shouldn't we just try to optimize labs? If we optimize labs, don't we make the person healthier? And the answer is no, that's a bunch of nonsense. Can we, if we put more thyroid hormones into the labs, could we see a change in symptoms? Maybe temporarily, but manipulating most blood values with medications, hormones, doesn't restore optimal function, in my opinion, in most cases. What it does is manipulate lab values, creates temporary symptom improvement, but it doesn't really address the root issue, and it has the potential to cause harm. So no, I don't think we should try and optimize labs or manipulate labs. I think if we're going to try and optimize labs, it should be by reducing the stressors that are causing the adaptive changes in labs. And as we reduce the stressors and trainers, stresses and strains on the system, those labs can go back to normal. If you have any questions, put them below wherever you watch the video. Thanks.